sometimes these doctors don't understand what we have to go through. I have to eat to make sure that I am full and can concentrate and work until I get some time to eat lunch. Sometimes I don't even have the time to eat lunch. I have to make sure that I have a very good breakfast. And I think, maybe he should just try and help me get the numbers down. I'm sure a pill could take down the numbers and give me some time to come to terms with this new diet thing that he's trying to push. I can bet you some white people chart he was using to determine that I am overweight. Do I look overweight? I don't think so.
Are you a little on the fluffy side? Medically speaking, there are serious side effects from moving from the fluffy situation to the obese situation. And this week, Family Doctors in Action is going to take a look at this condition. It's a medical condition. It's not just a fun condition. It's not just a look. I'm Dr. Arna Brown Morgan. I'm your host. Obesity is a condition in which a person's body mass and your weight is at least 20% more than the ideal body weight and mass should be. It can have severe side effects on you. If you are obese, listen, because you can risk your life. The comorbidities that are associated with obesity, and this means the diseases which go along with obesity, are hypertension, diabetes, dyslipidemia, that's too much fat in the blood, high blood cholesterol. Know this, these conditions come with other devastating health complications like hypertension, like stroke. Every single health condition starts somewhere. And obesity often starts from childhood. If it's not starting from childhood and coming along, it may come during a stressful period in your life. If it's not coming at a stressful period in your life, for some women it's happening after childbearing. They just don't lose the weight they gained when they were pregnant. And it just develops. Or it comes as we get older. Do you know that as you get older, you need to eat less? So, that said, what does the average Jamaican think is the difference between being fluffy and obese? Listen.
Obesity is someone who is large, very overweight, like 200 plus pounds. You would call someone in the obesity category. Fluffy is someone who put on a little weight, more than the usual. For instance, somebody said they weigh about 150 and they might put on a 20 pound or so. You probably call them fluffy, 20, 30 pound. You call them fluffy, but also obesity is somebody that are really large in size. That's it.
I think the difference between fluffy and obese is that obese is really uncontrolled weight. But fluffy, it's more controlled, more sexier, And then, you have a new thing now where them called thick. You have a thick woman, the one them where, them have a whole heap of weight about them strong. Yeah, firm. Yeah,
So, we are now about to turn to a patient visit with Professor Marvin Reed, who is not only an esteemed family physician, but is the head of the Tropical Medicine Research Unit at the University of the West Indies. He's going to do an interview with his patients, and he's going to also show you what happens in his setting regularly and how he deals with obesity.
My name is Marvin Reed. I'm the director of the Tropical Metabolism Research Unit, and I'm also a family physician. Now, one of the problems that we see very often in our family practice are problems related to dietary choices. So essentially, individuals may come in being very fat, very skinny. Sometimes they may even have diseases that have a strong dietary component to it. For example, They may have conditions like diabetes, otherwise called sugar, or they may have high blood pressure. These are just some of the common problems that we see in our practice that have a strong dietary component to it. One of the questions that is often asked is, why am I fat? Why do I get fat? Why is it that my family member or my friend eat worse than I, and I'm the one who ends up being fat? Well, the data says that there are many factors that contribute to an individual becoming fat. Some of it has to do with your genes that you've inherited from your parents. So sometimes you will find fatness clustering or appearing in families. Other reasons, though, has to do with our lifestyle. And I think most times that's a major contribution or contributor to individuals becoming fat. Mrs. Jones.
Yes.
I have some bad news for you today. I've had a look at your ultrasound report as well as your blood sugar numbers today. And your ultrasound confirms what I've been suspecting all along, and that is that you have gallstones. As well as the fact that your blood sugar numbers today says that your blood sugar is not under control. In fact, your numbers suggest that you have diabetes.
Oh, Lord.
Now, I think that a common factor that is causing both of these problems has to do with the fact that you are overweight. And I think that we will have to embark on a program for you to lose some weight so that you can improve these conditions.
What do you mean by overweight?
Well, essentially what we're saying is that the amount of weight you have for the height that you have is far too much. So when we last checked, the numbers that we got on the scale was that you were 190 pounds. And at 5'4", that makes you grossly overweight, because when we calculate your BMI, which is your body mass index, it's in the obese range.
But I thought overweight means that you can't manage the weight that you're carrying, and I'm managing very well.
Not quite. So for us as doctors, we define anyone who's overweight who has too much weight for their height. And in your situation at 5'4", we would expect you to be weighing anywhere between 120 and 130 pounds.
Did you take into consideration the size of my bones? I'm very big boned.
Yes, we took into consideration the size of your bones. And that's a common misconception that people have. That is that if they have very big bones, then they're supposed to have more weight. But the truth be told is that the consequences that you are now experiencing is related to the amount of fat tissue that you have. And the amount of fat tissue that you have is related primarily is what's contributing to you reaching the excess weight that you have. So in fact, what we're saying is that you have at least 50 to 60 pounds extra weight.
I don't see 50 to 60 extra pounds on this frame. Look here, you see anything sagging, sir?
Well, the issue is...
Maybe I could lose a little weight from under my chin. You understand? It would look a little better. But...
Well...
50 pounds?
50 pounds. Now, in you are fortunate enough in that the extra fat is distributed relatively evenly over your body.
Okay.
Some individuals, the extra fat is only in their tummy. Some individuals, the extra fat is only in their bottom. Some individuals, the extra fat is only in the upper parts of their body. But irrespective of where the extra fat is, we know that there is always a consequence or problem associated with that. And believe me, Mrs. Jones, if it is that we were to even lose 20 pounds out of that extra 50, I'm almost sure that your blood sugar numbers will come down to within the normal range.
I heard what you said, and could you give me a pill, sir?
Unfortunately, there are no magic routes to losing weight. Individuals always ask, is there a pill? Individuals always ask, is there a diet sheet? Individuals always ask for some magical method to actually lose the weight. The issue is the weight that you have acquired now, the weight that you are now, is really a culmination of how it is that you have behaved over the last 30 or 40 years of your life. So in essence, if it is that you want to lose the weight and have the weight stay off, it means therefore that one has to engage, or one has to decide that one is going to change how we live our life. And by that we mean one has to have a full understanding of the things that we eat, as well as a full understanding as to the activities that we participate in. Because it is a balance between what we eat and the activities that we participate in that really determines whether or not what our weight levels are. So if it is that you have spent most of your time being active, then you tend to have relatively normal weight. But if we spend very little time in activities but continue to eat, then typically we gain about 2 to 5 pounds per year.
I have been fat from I was a child, and my family is fat, so I don't expect to be slim. And as a matter of fact, I'm slimmer than most of everybody in my family. So I don't know if I agree with you, but I'm listening.
The challenge we have is that we have a cultural acceptance in the Jamaican society for people being overweight and being fat.
I need a fat girl.
As being a sign of being healthy, and that if you are normal weight and skinny, that it may represent some form of a disease process. The issue though is that we won't be able to move forward until Mrs. Jones accepts the fact that she is overweight. There's no amount of magic, there's no amount of coercion that I can do to force her to address the health concerns that she has. Sure, I could give her a pill for her diabetes, and that will help somewhat. Sure, I could give her a pill to try and help her lose the weight, but typically what the data says is that after 3 to 6 months, the effects of those pills are non-existent, and people end up regaining the weight and becoming quite frustrated in the effort. So clearly, in dealing with these chronic conditions, the best approach is to work with the patient to accept that they have a problem and to work with them to try and find a solution that is acceptable to them. Successful persons who have lost weight, one of the first step that they have to make is to accept that there might be a problem. And it's something that I'm prepared to discuss with you some more to determine whether or not we are in agreement that it is a problem. It is my professional opinion that your problem of gallstone and your problem of diabetes is related to the amount of weight that you have.
Sometimes these doctors don't understand what we have to go through. I have to eat to make sure that I am full and can concentrate and work until I get some time to eat lunch. Sometimes I don't even have the time to eat lunch. I have to make sure that I have a very good breakfast. And I think, maybe he should just try and help me get the numbers down. I'm sure a pill could take down the numbers and give me some time to come to terms with this new diet thing that he's trying to push, I can bet you some white people chart he was using to determine that I am overweight. Do I look overweight? I don't think so.
In assessing somebody's level of obesity, we have to do what we call a standard nutritional assessment, which involves initially obtaining the patient's weight and height. And from those two numbers, we calculate their body mass index, which is BMI. Your body mass index is going to be your weight in kilograms divided by your height in meters square. And the cutoff points are, if your BMI is over 25, you're considered to be overweight. If your BMI is over 30, you're considered to be obese. And if it is over 35, you're considered to be morbidly obese. So we have the weight and height of Mrs. Jones being measured now so that we can put her in the appropriate BMI category. One of the contributing factors for individuals to become overweight or even to become obese is their inability to appreciate what we call portion size. And portion size actually relates to the kinds of food that you eat. So for example, from a nutrition standpoint, the amount of rice that you can actually hold in your hand, as you see me holding this amount of rice here, is actually one portion, all right? This is actually a banana, which represents a portion of a fruit. All right? This small cup of vegetable here represents what we consider to be a portion of vegetables. So the common mistake that most people make is two things. One, to understand what we call the relevant food groups, as well as to understand the amounts of the respective food groups that you need to consume to maintain your health. So typically in the Jamaican diet, we tend to overconsume a lot of starchy foods. So starchy foods are like foods like this potato here. We have a lot of starchy foods like pasta or macaroni and cheese. This is cake, or also what we consider to be starchy food. And cereals, to some extent, represent some degree of starchy food. And what tends to happen is that our diet tends to be skewed a lot with either fat or starch. An example of us getting a lot of starch-related foods that sometimes we are unaware of is what we drink. So a lot of us will drink sodas, a lot of us will drink lemonade, tea. So in nutrition, we speak of calories, which represents the amount of energy that the body produces from the foods. And if it is that the amount of calories that you take in is more than the amount of calories that you expend or use up, what is going to happen is that extra calories is getting converted into fat. I'm happy that we're now on some common agreement that you will at least try to alter your eating pattern so that we can try and see if we can get you to lose some weight. The first step in that process is for us to understand how much you're actually eating on a daily basis. So I have here on the table what we call food models, which typically we use to help us assess and measure how much it is that you're eating on a daily basis. So I'm going to try and work with you to try and determine roughly how much that you consume in any one day.
Okay.
All right?
Okay.
So can you tell me, for example, what it is that you had and how much that you had for breakfast yesterday morning?
Well, I had 2 eggs scrambled with 2 slices of bread and a sausage on the side and a cup of porridge, because I like to have a good meal in the morning to carry me through the day to lunchtime.
Okay.
And a cup of coffee.
All right. If this was the cup, about how much of this would you have? If this was a cup of porridge, about how much of this would you have?
I would have had maybe 2 of this.
You've had 2
It's
of
a
this.
nice big mug, yes.
All right. So this is a slice of bread, white bread. About how many slices of this would you have had?
I would have had 3 slices of that.
About 3
Because
slices
I
of
had
that.
a hard-dough bread and it was nice, thick slices.
Okay. And this represents a sausage. About how many sausages did you
I would have had 1 of those.
1 of those. So for the morning, if I'm to get you clearly, you had 2 bowls of this,
Yes.
3 slices of this,
Yes.
1 of this.
Yes.
And you said you had some tea as well?
Yes, some coffee.
About how full?
To the brim.
To the brim. Okay. The other thing you must understand, Mrs. Jones, is that everything that you eat, for the most part, with the exception of water, provides you with energy. And that energy we measure using a unit called calories.
Okay.
All right? And what we're trying to do is to assess how many calories that you have taken in. All right? We'll also indicate to you how many calories that you can burn by doing various activities.
Okay.
And what you're trying to do is to, over a week period, you want to ensure that the amount of calories that comes in on one hand is equal to or less than the amount of calories that you're going to burn. So if you want to maintain your weight steady, then the calories in must be equal to the calories out. If you want to lose weight, then the calories in must be less than the calories out.
But
So-
sir, I don't eat according to calories, I just
know.
eat until my belly full.
To help us set goals for Mrs. Jones, we're now going to be doing an assessment of where the fat is in our body. This assessment can be done using several techniques, but the techniques that we're going to be doing now is called a DEXA scanning technique, where using x-rays, we are actually going to determine where the fat is on our body and really to answer her question as to whether or not she really has big bones or not. The DEXA gives us the fat distribution, where the fat is, whether it's in the tummy, it's in the chest, it's in the hip, as well as the amount of fat that she actually has. Because the goal of our intervention is going to be trying to reduce the amount of total fat that she has in her body. We've just had an interview with Mrs. Jones, who has two major problems, that of gallstones and that of diabetes. And one of the factors that's contributing to her problems is the fact that she's overweight. There are three important skills that you're going to need to master if you're going to go on a weight control program. First, you have to appreciate the different food types. So you're going to know that there are starchy foods, fatty foods, food from legumes and peas, fruits and vegetables. All right. Then the second part that you're going to need, the second skill that you're going to need to learn is portion size. What is an adequate amount that you should eat from a particular food group? And then the third that you're going to need to learn is that you're going to have to try and ensure that your activity patterns match what you're taking in. I'm Professor Marvin Reed, and that was my nutrition tip for weight control.
Now you see that patients don't always agree with the diagnosis that their doctors are giving. Patients have come to see me, and mostly they're not just coming to deal with obesity itself, but they are coming because they are suffering the outcomes of obesity. Some have had a stroke, some are just unhappy because they've lost their boyfriend, some just don't know how to deal with it, they don't even know how to, they don't want to say, this is how I'm having these emotional problems, and it's because I am obese and my boyfriend just prefers somebody who's slimmer, and he's seen me gain weight over a period of time, and he's been hinting, but he hasn't said anything like I'm ugly or I don't like this. But guess what? He's left. He's left. And people come at that time depressed, they come for counseling, they come for advice, they want to lose weight. Don't be motivated by poor outcomes in your life. Don't wait for something bad to happen, like a stroke or like a heart attack because your blood vessels are clogged. Go see your family practitioner now. Today is the day. Remember, the best way to treat obesity is to eat right, a healthy diet, less carbs, less fats, more grains, more fruit, more vegetable, and exercise more, walk more, just that. Work in your garden, tidy up more, just that. Go to your GP and hear how to begin a weight management program. You may also need the assistance of a dietitian. Let your GP introduce you to that person. I'm Dr. Arna Brown Morgan. I'm your host. Please join us next week at Family Doctors in Action.